for your subscriptions. Thank you so much for watching my video, for your comments. Thank you so much. So today's video, I'll be talking about convincing you. I'll be convincing you of why you should become a nurse. And the title of today's discussion is Convincing You of Why You Should Become a Nurse 10 Years Later by Nurse Jimoh. The title of this broadcast, this live streaming, is Convincing You of Why You Should Become a Nurse 10 Years Later by Nurse Jimoh. If you are just joining this channel, please don't forget to subscribe to my YouTube channel, hit the like button, share this video so that this could benefit someone. Alright, having said that, let's dwell in details to this video. So pardon me, I don't know if you can hear me very clearly. Let me first test. If you can hear me in the chat, please please comment in the box if you can hear me very clearly. Check for me if it is showing on your side. So I just want to be sure that you can hear me clearly at home, wherever you are. Am I audible enough? Do I need to proceed? You're welcome, you are welcome everyone. So I shall be starting the discussion proper in the next 5 minutes. So I want to be sure that you can hear me very clearly over there. Can you hear me? Okay, so going to the video. Okay, as you are joining, please like, share, and subscribe. Thank you. Like, comment, subscribe, and share. Thank you very much. So as I said earlier, I'll be kick-starting the topic of this discussion for today. Pardon me, the network is a bit fluctuating. But this is in it, I think you. So convincing you of why you should become a nurse. Convincing you of why you should become a nurse 10 years later, Nurse Jimoh. Don't forget, as you are joining, please like this video, comment in the section box, and subscribe to my YouTube channel. This thing is later. This is later. Okay, so having said that, today's video, as I said earlier, is convincing you of why you should become a nurse 10 years later, nurse Jimoh. So as we all know, this is basically, this channel is created talking about nursing, nurses, vlog, lifestyle, health, travel. So in the light of that, on that note, I'll be starting the presentation right now. Okay, so convincing you of why you should become a nurse 10 years later, nurse Jimoh. So we'll be talking about why do you need to become a nurse? What are those benefits that is attributed to you becoming a nurse? And what are those challenges that are also attributed to becoming a nurse? Why do you need to become a nurse? Or even if it is not you, why do you have to have someone by your side, or someone beside you, or your family or relatives or friends, to become a nurse? Why does this has to happen? Why does this has to be so? So um, first of all, you should know that becoming a nurse is solely the individual choice. You have chosen that you want to become a nurse, and so mine in this on this channel today is to guide you of those reasons, those pros and cons that are attributed or that are attached to you becoming a nurse. So first of all, nurses are the eye and ear of the hospital. Nurses are the backbone of every hospital. Okay, okay. Nurses are the backbone of the hospital, and so they are the eyes and the ear of the hospital. They are empathetic. They are empathetic in nature and sympathetic in nature. Nurses and nursing has many prongs, from great pay to diverse job settings. Nursing has many prongs ranging from great pay and diverse job setting. I personally, having worked after working as a nurse, I have a lot to say about this profession. If you are live on this channel, let me know in the comments box if you can hear me or see me very clearly. If you can see me clearly, if you can hear me, let me know in the comment box if you can hear me. If you can hear me, let me know in the comment sections if you can hear me what I'm saying. Can you hear me? Can you see me? So while waiting for that, let me proceed. So a lot of people have asked me, why did they need to become a nurse? Why did they need to have a relatives, family and friends to become a nurse? In that note, so I'll be saying some reason why you should become a nurse. Those the pros and the cons that are related to nursing profession. So so first of all, I will be convincing you on this number one point of why you should become a nurse, or why you to have a close relatives or a relations to become a nurse. First of these is leadership opportunity. Leadership opportunity. Having become a nurse, being a nurse, you have the opportunity to become a leader. And a leader is a manager. So when you studied nursing, after graduating from the university or the colleges of nursing, while you be working, you will place in a setting where you have to perform a leadership role. Part of these leadership roles include supervising the younger professional colleagues, delegating of duty, or delegating of care, delegation of care. So also it includes you, you know, supervising the activities of other support staffs, junior support staffs, working on the floor of the ward, the room, the unit, the department with you. So you need to become a nurse to have that leadership opportunity. Yes, you might ask me, why did I say so? Is there no any other professions, any other course that can read, or program that can read that will also grant me this leadership opportunity? Well, I said yes. There are other opportunity. There are other course programs that you can read that can grant you this same leadership opportunity. But then remember, nursing profession give a great leadership opportunity. Nursing profession give a great leadership opportunity. Also, high demand for nurses. High demand for nurses. There is high demand for nurses. Daddy, if you should become a nurse. Don't put it in your head again, it will injure you. So high leadership opportunity is paramount from a nurse. Can you hear me, please? I don't know if you can hear me from your hand there. So also, can you hear me? If you can hear me, let me know in the comment box if you can hear me. Let me know in the comment box if you can hear me very clearly. Thank you. Thank you for sending the kudos. Thank you so much. So let me know in the comment box if you can hear me clearly. Just in a word, I can hear you. So the number 2 is high demand for nurses. If you become a nurse, the job probably before you finish, as you are finishing your school, your program, your course, the recruiters are already demanding for you. So you have high demand as a nurse or becoming a nurse. The another reason I'll be convincing you with is job stability. Excuse me for a minute for a sec. So you have job stability. You have job stability. You have job stability. If you are in nursing profession, if you are in nursing profession, you have job stability. What did I mean by job stability is in the sense that the job are readily available for you, and that is why you could be able to switch roles as a nurse. You could be able to switch roles or switch employment. You could be able to decide which type of specialty you want to embark on. So this job stability also includes that most of the nurses are placed on long-term payments. They are being employed most of the times full time. So you could easily have the opportunity of being employed full time. So job stability is there. Your job is stable. You work as a nurse. The work are always available for you. Anytime you want to work, the work are available. If even consider switching a particular specialty to another specialty, that is also doable. And nurses has a stable job. It won't be like you work today in the hospital and you're looking for another job in the next 1 week again. So no, the job is being employed permanent staff or full time. Even if it is part time, you know that this is a stable job opportunity. So nursing give job stability. Having said that, then we have alternative nursing careers. Alternative nursing career. What does this alternative to nursing career means is that you have the opportunity to even venture into another profitable business or entrepreneur. So there is that alternative nursing career. And also, if you are a nurse, you could be thinking of, deciding which of other career opportunity in nursing you want to venture into. For instance, you may decide to venture or to work as a flight nurse, as a sea nurse, and so on and so forth, to mention but a few. As a military nurse, to mention but a few. So there is alternative to nursing career, and you can even decide to be a privatized nurse. So you have alternative to the nursing career. Even while you are in the nursing profession, you might decide not to even work bedside. You might want to work, in the educational line, maybe lecturing, tutoring, and so on and so forth. The another reason that I'll be convincing you of why you should become a nurse, because having Having 10 years of experience in this profession, I have so much to say about nursing. Then we have high earning potentials. You might have heard it that nurses are well paid. But when I say nurses are well paid, we need to critically look into this so as to not be biased, to know are nurses actually being paid well. So this depends on the region, the geopolitical zones where a nurse is practicing or a nurse is. You might be you might be uh, in overseas, for instance, and in fact you have opportunity of high earning potentials. But for instance, a nurse that is practicing in Africa, in Africa, we consider this region as not having a high earning potentials. So nursing gives the opportunity of high earning potentials. Places like our in Africa, for instance, Nigeria, nurses are not well paid compared to other professionals. And that is why a lot of nurses move from this underpaid country to a well-developed country where they have the opportunity of high earning potentials. Nurses in Nigeria, for instance, are not being paid well. Although we cannot be under comparing nursing profession with other lower courses of program. We can't say because Ali some nurses collect higher salary than even other work working category. Yes, quite alright. Nurses might collect higher pay compared to other working categories in the same service. But then, that doesn't mean that we stood ourselves solo, stood the nursing solo, that will now say that, for instance, in Africa or in Nigeria, nurses are well paid. No. So if you become a nurse, just know that you have the opportunity of higher earning potentials. I mean, you could earn more dollars. You could earn higher dollars, higher pounds, higher currencies. You have that opportunity of earning that higher. Then other things that I will be convincing you with of why you should become a nurse is nurses experience job stability. The job is stable. Most of the times you hardly find a nurse not having something doing. Most of the time you hardly find a nurse not having something doing. And so this job stability. There is job stability. You have a stable job, you have something doing, without practicing with the government, working as in a private setting, or privatizing your skills, your professions. So there is this nurses have job stability. Nursing has a vibrant community. If you are a nurse, if you study nurses, just to let you know that nursing has a vibrant community. Community in the sense that there is a regulated body, there is a regulated professional associations, and there is other sub accredited acceptable associations, communities in nursing. For instance, if you study nursing, if you read nursing, you have the opportunity of being able to be licensed by a professional body. For instance, the International Council of Nursing is a whole professional body that supervise the activities of professional nurses and midwives all across the globe. And in Nigeria, for instance, we have Nursing and Midwifery Council of Nigeria, a professional body that regulates, supervise, you know, the activities of all nurses and midwives in Nigeria. So you being a nurse or being not studying nursing profession, you should know that nursing has a vibrant community. Then also we have an association, a professional association body, such as we have nursing, nurses and midwifery association of Nigeria, NAM. So this is an association that support, you know, the activities, the practice of Nigerian nurses and midwives. That is the Nursing and Midwives Association, National Association of Nigerian Nurses and Midwives. Please, can you hear me? Let me know in the comment box if you can hear me very clearly. Thank you very much. So going forward, nursing is a true calling. You should study nursing. You should encourage that your family members, you should encourage your friends, your relatives to study nursing, because nursing is a calling. In fact, before you could say that you want to do nursing, you should have you know you should have how would I call it, you should have uh, that motives, that drives, that you want to help for people, you want to care for people, you want to, you know, render care and assistance to people. You should have that mind that this is what you want to do before you could even think of find yourself in nursing. So on that note, we have salary. Nurses, I tell you, just as I said earlier, has a high salary compared to other career workers. But that doesn't mean that in less developed countries or nations or regions like Africa, that doesn't mean that nurses are, are receiving higher pay. In fact, in Africa, nurses are not classified as the most top paid professionals in Africa. But in developed countries like United States of America, Canada, Finland, United Kingdom, Australia, Switzerland, European companies like Germany's and the rest of those countries, you found out that nurses are being paid well. And with that, they could afford a living. And with that, they could afford a living. So salary is also one thing that you need to think of. You need to know that nursing have a competitive salary, but not in this part of the world that me personally I find myself in Nigeria. In fact, in Nigeria, you find out that a lot of nurses are collecting way below the minimum wage. A lot of nurses are collecting way below the minimum wage. But when I say minimum wage, I think minimum wage currently is 70,000 naira, which has not even been implemented. So a lot of nurses collect salary way below the minimum wage of 70,000 naira. You could imagine. So when we said salary is part of the reason why you need to be convinced of studying nursing, uh, in this part of the world, you have to say clearly that nurses in Nigeria are not receiving a higher pay compared to other African or compared to other developed countries. Then we have diverse opportunity. You have a lot of opportunity when you study nursing or when you venture into nursing. When you venture into nursing, in fact, the opportunity for you is limitless. You can decide to venture into entrepreneurship. You can decide to be a school nurse. You can decide to be flight nurse. You may choose to be the military nurse. You may choose to be the Z nurse. You may choose to be the civil nurse. You may choose to, you know, you may choose to practice the nursing as you wish, as you like, as according to what is being established. In fact, in nursing, you might even choose to be either clinical or educational nurse. So you have diverse opportunities, growing demand, growing demand. Whether we like it or not, the demand for nurses will continue to be on the high side. The more older nurses retired, the more the demand for the younger nurses to fill up the gaps will increase. And also due to the population changes, there is increased populations, increased patient workload, and so this call for increased nursing care. This call for increased employment rate of nurses and midwives globally. Excuse me. Then high satisfying career. Nursing profession is a career. If not of recent in the country like Nigeria, where the verification process for registered nurses and midwives to move outside the country is being suspended. Other than that, nurses have a high satisfying career. Kudos to you. Oh, thank you. Thank you. Thank you so much for sending that word of encouragement on this life. Thanks. Please don't forget to subscribe. please don't forget to subscribe. Okay, so moving ahead, high satisfying career. Then we have nurse educations. When you enroll into nursing, thanks, please don't forget to subscribe. Thanks. So when you enroll, when you venture into nursing, do you have nurse education? You can decide to be a nurse educator. You can decide to, do other specialty in nursing, such as we have, you know, perioperative nursing, oncology nursing. The perioperative nurses, these are specialist nurses that are in charge of patients, um, surgical patients, let me say, surgical patient going for surgery, and the theater and the likes. So while the oncology nurses, these are nursing professional specialty that deals with oncology cancer cases. So we have an emergency nurses. These are the nurses or the nursing professionals that work. Excuse me. Excuse me. These are nursing professionals that work solely in the emergency room. These are nursing professionals that work solely in the emergency room. So that is nurse, nurse profession, other specialty in nursing. So you have that to choose whether you want to have nurse education. And nursing education in nursing is unlimited. So you can even reach to the level of PhD and also postdoctoral graduates. You can reach to the level of doctor. And if you choose to be uh, to advance your clinical careers, you can be a nurse practitioner. So this is also an advanced nursing specialty that you could think of. So these are juicy aspects of nursing. Then the flexible schedule. Nursing has a flexible schedule. You could work 12 hours, you could work 8 hours, you could work 10 hours, depending depending on depending on the organizational work schedules. So, and also the flexible schedules is in this regard that you can decide to do day shifts, you may decide to do the night shift, or you could even decide to be doing the afternoon shift. So this flexibility is there in nursing, that you could choose which shift pattern you want to choose. Then professional respect. Though nurses are undervalued globally, but still, nursing still had the respect of a professional. Nurses are still being respected compared to other work career, because the society know that we are providing an humanitarian work. We are providing an humanitarian service. So professional respect is there in the nursing field. Then global opportunity in nursing. Nursing, as you see it, you have the opportunity to be globally, have to venture into the opportunities that is there, that is out there. So you have the global opportunity in nursing. Global opportunity in nursing is there. So this global opportunity could range from international research. This global opportunity could range from international research. Come and get your, come and get your So these global opportunities could range from it, conducting international research, participating in international studies, reviews, and the likes. So there is global opportunity in nursing. This nursing, if you venture into it, could carry you go anywhere in the whole world. Then job options are access various fields. So job options, you could decide which type of job you want to do. Then you have access to various fields. You have access to various fields. Nurses receive excellent benefits. Nurses receive excellent benefits, especially in the developed countries, developed world, where nurses are being highly respected, are being paid well, or their welfares are being taken care of, unlike as we have in Africa, back in Africa or in Nigeria, where nurses' voices are not being heard, their concerns are not being taken into cognizance. For instance, where you have the issue of verification process that has been suspended for over 9 months now in Nigeria, and there could not be verification process for any of the registered nurses and midwives qualified or registered with the Nursing and Midwifery Council of Nigeria. And this will hinder them from conducting international research. This hinder them from participating in international studies. This also hinder them in seeking greener pasture. So nurses in Nigeria, for instance, receives actually not excellent benefits in this regard. So but nursing generally receive excellent benefits. You could heard of different allowances, especially this could come into play in the developed countries like United States of America, Canada, Australia, United Arab Emirates, Qatar, Saudi Arabia, Australia, name it, Finland and the likes, United Kingdom. So name it. So this is where nursing will have, receive excellent benefits. So we also other reasons why you need to encourage that close relative of yours, your friends, your family, or you yourself to study nursing is competitive salary and perks. In fact, in some countries, you are being no, you are being begged to come and do some shifts. You're being begged to come and do some shifts. So this competitive salary and perks is there in nursing. Venture into nursing, study nursing, encourage your family, your friends to study nursing. They have this opportunity of competitive salary and perks. You be begged to come and even perform a particular shift that you are going to be paid for. So imagine, so it's only this nursing profession you could see that you be begged, in fact, the part of the perks that we could also say is when it comes to international recruitment, where a nurse will be booked. In fact, his flight accommodations, will be booked over to come and work, to go and work in those outside countries, those developed countries, and perhaps they are going to pay the nurses well. So there are perks, there are competitive salaries in nursing. So when you venture into it, so I advise you to venture into nursing. Then we have flexibility. Nursing is flexible. In fact, as a matter of fact, you might be studying nursing and be having, you could be able to venture into entrepreneur. Even while working as a nurse or midwife, you could have other businesses that you are doing. You could have other career nursing progressions that you are venturing into. In fact, you could be working and schooling at the same time. So that flexibility is there. So for instance, the licensed practical nurse that that is working, an LPN that is working as licensed practical nurse, those that person can be working, be gathering the work experience, and also be enrolling into school where the person can be, can be able to have the registered nurse qualifications and be able to work as registered nurse. So you can be schooling and be working at the same time. So that flexibility is there, and when you want to work, you can decide to work day shift, night shift, evening shift, depending on your choice or the organization's availability, the schedule's availability. So there is this flexibility in nursing. So I encourage you to venture into nursing. I encourage you to not deviate from nursing. Perhaps if you deviate, if you are already a registered nurse, you deviate from nursing due to one thing or the other that doesn't give you satisfaction, that you consider as absurd, especially from the country that you are, especially in Nigeria, due to the education that is being put on hold for the past 9 months now. A lot of nurses tend to even regret why they become a nurse. Please don't regret. I would say nothing lasts forever. So it's a matter of time. It's a matter of time. As time goes on, the verification will be opened, but we might not know when. The only thing is, nothing lasts forever. Nothing lasts forever. So it's just a matter of time. So don't think why did I even become a nurse? I'm being paid peanuts. I hardly afford basic living. This is what we are experiencing in this part of the world, in Nigeria, for instance, presently, where the verification process has been put on hold. We could not, you know, use the verifications to seek greener pasture, to seek migrations, to studies, to being verified at the workplace of those in diaspora. A lot of things to go for schooling. So this could not be possible, and nurses in Nigeria are remaining stagnant. In fact, some of the board of nursing overseas are tending to reject or refuse the nurses application due to the fact that the verification of licensure process is being put on hold in Nigeria. So I encourage you so to not to not feel that is this a profession. We just find ourselves in this kind of a country where things are not in order. Nursing are not being nurses are not being heard of. So there you could see the nurses have said their mind then of why they need this verification portal to be opened. For crying out loud, there shouldn't be a closing of portal of verification of nurses. It is individual choices to decide where you want to work, how do you want to work. You can also decide how do you want to be get paid. In fact, we have a lot of nurses that are doing voluntary nursing. A lot of nurses and midwives are doing voluntary job. So we have it like that. So why mandating that? There should be these guidelines that are very strict to the core for nurses to be able to have before they could be able to travel out, or before they be able to seek migration. This is absurd. This is not good. This is not fair. This is not fair. So please, we are also pleading. I am pleading on behalf of nurses and midwives in the country. Please hear our voice, the Nursing and Midwifery Council of Nigeria, a professional body, the National Association of Nurses and Midwives in Nigeria. Please also listen to the cry of the nurses and midwives. Verification portal is being put on hold, it's being suspended, there's no verifications, a lot of nurses are being sent back homes, there are devastations, the salary will not even cater for the nurses and midwives alone, talk more of their families. So this will not make me to now say that the younger generation should not venture into nursing, should not study nursing. So I am encouraging the younger ones to please study nursing, because the older generations one day the faces they are going to face out, they are going to retire. And so when they retire, it is this upcoming one that will take up the position. And also let me tell you, there are great incentive that is being put in place as regards the nursing education in Nigeria, for instance. So you could see the number capacity of the nurses and midwives that is being accredited or that is being indexed to study nursing in Nigeria has increased from 50 to as high as to above 50, let me just say it in that way. And this is a good development as regard nursing education in Nigeria. A lot of colleges of nursing are now accredited and they could run nursing program in Nigeria. So this is a good development. So I am advising you, I'm convincing you, if you are thinking or you have that close relative or you have that your children or you have your family or you are even a nurse and you are saying that in fact you will not want your generations or younger generation, your offspring to become a nurse. So I am convincing today, forget the fact that in this part of the country where we are undervalued, underpaid, and looked down upon, the voices of nurses and midwives are not being heard. So forget that fact. Still, there are still the good parts of nursing. Although there is nothing good as bad as frustration. Nurses are being frustrated in this part of the country, Nigeria, where the verification process for almost 9 months now has been put on hold. And this is what if for instance now I see greener pastures, I practice in another country and I make increased and a good salary out there, of course I am going to return back to the country, invest 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 in nursing, do other good things that going to to increase the economy of the Nigerian system. So that's it. So another convincing things that I need to say to you, that nursing is both practical and academic. Nursing is both practical and academic. So nursing generally is hand-on skills. I can say it's an hand-on skills profession. It's an hand-on skills professions. It is being backed up by research and science. It is being backed up by research and science. It is both practical and academics. You're going to work in the clinical settings and you're going to do more of also theoretical work. So you're combining both theoretical and practical setting. Unlike some courses that you are thinking of doing that have only academic modules. So nursing is not like that. It has both academic and practical modules. So also is you need to study nursing because it is a means of you helping others. It is a means of you helping someone else. When you study nursing, you can help yourself. You can help your family. You can help others. It is this true nursing that you can help others, that you can help your family, you can help yourself. Imagine, for instance, if you are a registered nurse and you have your family, one of your family member has a minor injuries that you could use first aid at home to do it. So you could see this is an advantage to you of becoming a nurse. Or you have someone in the family that has studied nursing and a minor emergencies occur, the use of first aid by this person before later moving the person to hospital, the importance of it cannot be overemphasized. So it is a good thing. Study nursing, you are helping yourself. When you are sick, you know that this is headache they are having. When you are having fever, you know that you are running temperature. So, and if you put these two things together, you tend to be thinking, are you having this? So, like over the counter medications such as malaria, anti malaria, you could be able to diagnose your family member to be able to take an OTC, over the counter drugs, over the counter medications, to treat minor ailments or minor injuries. So you help others by studying nursing. You help yourself by studying nursing. You tend to even know more of health hygienes, positive lifestyles. Positive lifestyles. You tend to emulate or even know more of the disadvantages towards sedentary lifestyles. And when you know this, you tend to not even, you know, encourage someone closer to you, your family, friends, and member, or yourself, to engage in sedentary lifestyle. Then, how we also say this: nursing fits your personality. If you are the type that you like caring for people, you like taking care of someone, if you are the types that you like, you know, being sympathetic towards someone, so nursing fits that your personality. Yeah, boy, I'm coming with you. I'm coming with you. I'm coming with you. Okay, so if you are the types that like, taking care of someone, caring for others, so this nursing fits your personality. You will thrive very well, because all what nursing is about is caring. In fact, nursing has been defined as an art and science. Nursing is an art and science. And nursing is also a form of caring for an individual or family or community, sick or well, in order to achieve those roles that he or she will be able to do if he has the necessary skills or the ways to do so. So, and this is what nursing is all about. So, you do nursing, you venture into nursing, you are already a nurse, you are helping yourself, you are helping others, you are taking care of someone. And so by so doing, you are promoting health, you are alleviating sufferings, and you are alleviating suffering, you are promoting health, you are doing so much to ensure that an individual, the community, uh, the families are doing very fine. And lastly, this point, why I am convincing you of why you should become a nurse. Because my 10 years of experience make me to be able to see a lot, so much about nursing profession. You have what? You have travel opportunity. You have the opportunity to travel anywhere across the globe. You have the opportunity to travel anywhere across the globe. You could travel to any country of your choice when you study nursing. It is more easier when you study nursing for you to be able to travel all across the globe. It is very easy for you to be able to travel all across the globe when you study nursing. For instance, you could travel to more developed country than yours. You could travel to United States of America. You could travel to Germany. You could travel to Australia. You could travel to Switzerland. You could travel to Malta. You could travel to Ireland. You could travel to Canada, you could travel to Saudi Arabia, to United Arab Emirates. You could travel to Qatar, which has the highest denomination of currency. So you studying nursing or encouraging someone to study nursing, you have a lot of opportunity for you to be able for you to be able to study that nursing. When you study that nursing, you have that travel opportunity. In fact, a lot of people have international work experience, and when you have international work experience, it also puts you on the higher edge. It puts you on the higher edge where where you know you are on top of the game. You have that, the recruiters could be able to be looking for you. Daddy, Papa. So the recruiters could be looking for you. The recruiters, you could be easily be selected compared to others that doesn't have international work experience. So I shall be ending this live soon. So generally, this video is a convincing video, convincing you of why you should become a nurse. My 10 years of experience as a registered nurse and midwife make me to be able to have so much to say about nursing profession, and I believe this has imparted so much in you. I believe this has imparted so much in you. So I am encouraging you to allow that your siblings, to allow your family, to allow your relatives, your families and friends to study nursing. If you and I that are registered nurses didn't face those ones that got retired. So thank you very much. I'm back online. My network is just fluctuating. I hope you can hear me and see me. So that is what nursing is all about. You need to study the nursing. You need to encourage someone to study the nursing profession because it has a lot of opportunity. Don't mind the fact that you are still back in Africa. After all, there are other professions that pay so much. Or why do you need to even continue to advance in this nursing profession in Africa? Remember, if there is no opportunity today, that doesn't mean that, or if the opportunity today is being suspended, just as verification, such as verification of license, it doesn't mean that it is going to be suspended forever. And so, you need to encourage yourself to advance. You need to encourage someone to advance in the nursing profession. I am encouraging nurses and midwives, home and abroad, to continue advancing in nursing profession and to continue encourage the younger generations to study, to venture into nursing, to read nursing. We don't want this profession to die down. Obviously, it might not be that all these sagas that are happening in the nursing profession, especially in Nigeria, it might not be our generations that is going to correct it. It might not be that it is going to stop in our generations. It might be those generations that are coming behind. It might be them that is going to stop those that has moved the nursing profession to a greater height. And so this is my convincing message to you. I hope you are convinced beyond reasonable that why you should become a nurse, or you should advance your career in nursing. Nursing is a whole lot. It is highly demanding. Though in some part of the country you feel frustrated, you feel down as like, why do you even become a nurse? But that doesn't mean that nursing profession generally all across the globe is not thriving. And I did a video, you can go and check it out. I said the video is about this is why nursing is not thriving in Nigeria, where I give a lot of reasons why nursing is not thriving, why nursing is not surviving in Nigeria. So please check that video out in my video segment. Thank you very much. So today again, convincing you of why you should become a nurse. So today again, I'll talk about ways why I've convinced you of why you should become a nurse, and says a lot of some reasons why you need to study nursing, why you need to encourage someone to study nursing, why you need to encourage your family and friends to study nursing. So, and I've talked about leadership opportunity. You have a lot of leadership roles to take into cognizance of. You have leadership opportunity. You'll be able to lead the floor, the ward that you have, that segment, that department, that unit that you are working as a nurse. So studying nursing gives you that leadership edge. And high demand of nurses is another reason why you need to study nursing. Nurses are highly being demanded. Your job is stable. You have job stability when you study nursing. If you are a nurse, you will also affirm to the fact that we have job stability. It might not be as to taste what we want, but it is something that we manage. Though it is critical in this part of the world, but job stability is there, especially if you travel out of Africa. Then alternative nursing careers, diverse nursing specialty, high earning potentials. Nurses experience job stability. Nursing has a vibrant community, such as we have the professional body that speak for us. But the reverse is the case as compared to what we experience with the National Association of Nigerian Nurses and Midwife in Nigeria. And nursing is a true calling. The salary is good, diverse opportunity. Though the salary here in Africa is poor, it's bad. Let's call a spade a spade. But in the abroad, out there, USA, UK, United Kingdom, Australia, Canada, Finland, name it, the pay are good. They are super really good. And there is growing demand, diverse opportunity, highly satisfying careers, nurse education, flexible schedule, professional respect, global opportunities in nursing. Job options, access various fields. Nurses receives excellent benefits, competitive salary and perks, flexibility. You'll be able to work flexibly. It is both practical and academic. You should study nursing because it is both practical and academic, and it will give you hand-on skills. And you have competitive salary and perks. Some are even beg to come and work. So it's helping others. You study nursing, venture into nursing, you read nursing, you are helping others. You are being sympathetic. You are providing cares to the sick ones so that they can be healed. And travel opportunity, it fits your personality. When you study, you are the types that like caring for people, that like being around people, taking care of them. So this profession is for you. Don't forget again, this is Nurse Jimoh YouTube channel. Ensure to like my video, subscribe to my YouTube channel, comment in the section box and share my video. And thank you while I see you in the next video, the next live. Stay safe, take care of yourself, and ensure you encourage that person, that your family, that friend, that offspring of yours to read nursing. And you should also, if you are a nurse already, advance your career in nursing. Thank you and bye. I shall be ending this live now. Hope you any questions in the comment box. Okay, thank you. Thank you too. Thank you. Thank you. Thank you so much. Is there anything you want me to talk? Add option. Is there anything you want me to talk about in the next video? Let me know your thoughts over there, and we'll do the due diligence to check that thought. So this live will be ending shortly, any moment from now. I'll be ending this live from now. So I'll see your thoughts out there. Okay. I'll be ending this live. Highlighted save to your channel as unlisted video upload. Okay, so I'll be ending the live now. Thank you so much for coming onto this channel. Thank you and bye. You want to stop streaming.